Good evening, everyone. My name is Robin Tyler, and I'm the Outreach Coordinator for Central Virginia Health Services. And on this evening, we are talking about Sister to Sister. Let my journey be your footsteps for awareness. Being that this is Breast Cancer Awareness Month, we want to make sure we're getting this message out to the masses. On this evening, we have CVHS Petersburg provider, Miss LaShonda Harris. We have Miss Regina Parham of Feelings to Fight. We have Mrs. Renee Cooper, and we have Mr. Marcus Gilliam. And tonight we are going to start with our medical provider, LaShonda Harris. LaShonda, what is the importance of breast cancer screenings?
So the importance of breast cancer screening is to get them aware of how to prevent breast cancer. The screening allows them to be tested and make sure that cancer is not present, and it's very important to have yearly screenings done.
Okay, so just for our people, what do they expect? What should they expect when they're going in for a screening from the doctor's office up until they're going to the hospital for a screening?
So when they come into the doctor's office, the doctor will most likely, do a self-breast exam to see if they feel any lumps. Even if they do, and if they don't, they will still do a mammogram.
Mm-hmm.
As far as the mammogram, the morning of, do not put any deodorant on or any perfume on. You will have the test done, and some people say it's very uncomfortable, where you will have to, stand to the machine, and sometimes it feels like your breasts are being pressed, but it's very important to have that test done.
Okay, and at what age are they recommending for you to start your screenings at?
It starts at 40, but if you have a family member, like a mother, sister, or aunt that's positive for breast cancer, it can start at 35.
Okay. So how might someone know that they are at risk for breast cancer?
Family history, like I said, a sister, mother, or aunt. Also, someone that smokes, drinks alcohol could put them at risk. Someone that's overweight can put them at risk as well.
Okay. What does it mean to be at risk for cancer?
What it means is that your chances of getting cancer are greater if you have a risk factor of that.
Okay. And what questions should be asked during a visit?
It's the patient. You're saying the patient?
Yes.
So if the patient notices that they feel a lump, I believe people should do self-breast exams. If they feel a lump, they need to let the doctor know that they feel a lump. If they have a rash on the breast, if they have nipple discharge, that's something that they need to ask the doctor about. If that's that is a concern, they need to ask the doctor about that.
Okay. What are the different types of interventions that someone can implement to decrease the likelihood of getting breast cancer?
Having a healthy weight, exercising, not smoking, trying to stay away from inflammatory foods, your processed foods, eating more healthy foods, your fruits, your vegetables, and your whole grains.
All right. And what are some of the stigmas that need to be dismantled regarding breast cancer?
I feel like women, you think about losing your hair, and a lot of people do not want to get tested because if they are positive and have cancer, they are afraid of losing their hair, of losing a breast if they have to get a mastectomy. I think that's a stigma as well.
All right. Thank you, LaShonda, for sharing that information and knowledge to us. Next, we're going to talk to Regina Parham with Feelings to Fight. How are you doing, Regina?
I'm well, and yourself?
I'm good. Reading your bio, former Miss VSU, your mother, your counselor, and you are a survivor.
Absolutely.
Tell us a little bit about your journey.
I was diagnosed in 2017. At the time of my diagnosis, I didn't have any immediate family member. I was the one who I wasn't even going to get a mammogram that year, but thank God I had a very persistent scheduler when I called to make my annual appointment, who just, like I said, she was more than persistent, and she insisted that I get a mammogram done, and no real reason other than, like you said, it was just that thought of like, what's gonna happen? I didn't know, and it wasn't on my things to do list. I hadn't made a post-it note that said I needed to go get a mammogram done, so I just wasn't doing it. But lo and behold, I had my first mammogram, and it came back that my breast cancer was a positive receptor for estrogen. So I was diagnosed with breast cancer. I guess trying to just go fast forward, went through a couple of different doctors. That's what I will say about all of this. Advocate for yourself. Do not stop. The advocacy for yourself never stops. Ask questions. If it doesn't sound right, ask someone else. Find someone else. Find somebody who can make you feel comfortable. I went through, I think, 3 different doctors before I was satisfied and content with the way the doctor was giving the information to me and what I felt like were my actual options. Because you always have treatment options. Don't always go with the first thing that somebody says. You have a right to get a second opinion. So, like I said, I went through 3 different doctors, and by this time, the back end of it, my cancer was steady progressing, and we didn't know that. And my cancer progressed. It was very aggressive. So by the time I had surgery, which was on 9/11, but again, my doctor said, who do you call on in a time of crisis? And I was like, you know what? That's the reason why you're my doctor. So I had my surgery on 9/11. Everything went well. I think I was in surgery for maybe about 8.5 hours. After my surgery, they do what they call a final pathology report. That's to make sure that they have everything. You have clean margins, and they haven't missed anything. Well, my cancer has spread to my lymph nodes. So because my cancer has spread to my lymph nodes, then I had to undergo chemo and radiation. The chemo just because that's the general treatment plan, and then radiation just as like a precautionary to kind of reduce the reoccurrence. So I did 8 rounds of chemo, and I did 28 daily radiation treatments. And I am, as of July of this year, I am now 5 years cancer free.
Amen. All right, moving right along, we have 2-time cancer survivor, Renee Jennings Cooper. Renee, your story touched me so much. 2-time, days away from celebrating the anniversary of being cancer free. Share your journey with us.
My first positive screening was in February of 2013, I think it was. I had undergone a lobectomy and followed by radiation. And through that process, I just continued with follow-up appointments and so forth. I think I was a little irritated when I first got diagnosed. Wasn't surprised because my mother was a breast cancer recipient. So I did everything possible to try not to have breast cancer. I too was positive for estrogen, as a estrogen receptor of breast cancer. So I was told that it derived from me taking birth control pills. I was never a smoker, not a heavy drinker. So I thought I was taking all the precautionary steps to not get breast cancer. But that was not the case. After I finished my treatment, and like I said, I followed up with all of my appointments, with oncologists, you name it. I actually started taking mammograms when I was 20 years old. Yeah, and I didn't get diagnosed until I was about 41, 42. So I've been taking them forever. Mine was a little different because of all the years that I had been taking mammograms, no one ever told me that I had dense tissue.
Okay.
So I discovered that after getting my diagnosis, and I'm asking, what is dense tissue? So, of course, the oncologist at that time explained to me everything I need to know about dense tissue. And as Regina stated, ask your questions because you need to have a response. And that's when I had to undergo a MRI. The MRI is what actually discovered that I had breast cancer the first time. And so through insurance companies, persons need to be aware that after you get a mammogram, and if they see any type of, as they say, the funny bubble, or anything that's they can't see, then they do the ultrasound, and that's when I found out about the dense tissue. So I had to undergo an MRI, and that's what picked up. So, as you say, as my journey progressed, that particular year, it was funny because, and that was in 2017, the Lord had spoke to me and said, you need to go ahead and renew your vows. And me and my husband had only been married 17 years. I was like, why are we doing this at 17? And it was brought to me the meaning of number 7. So that was in October 21st of 2017. And 2 months later, who would have ever thought I was shy of my 5 years? Because that February of 2018 would have been 5 years. I was told that the cancer had came back. So I took a different route this time. I wasn't angry initially. I just was in denial. I said, this is not happening, and I know it's not happening. I did everything they told me to do. I took tamoxifen, which was a blocker, hormone blocker. This can't be happening. And so the second time, I said, I think I'm going somewhere else. And that's when I went to Cancer Treatment Center of America in Pennsylvania, which was an excellent choice. They really use the holistic approach when treating patients. They're not open anymore, but yeah, they closed the Pennsylvania office. So I had to end up transferring to Atlanta, which is now called City Hope.
Okay.
A little different, but it's okay. This time, on my second journey, I had to have a mastectomy and followed by 4 rounds of chemo. What really helped me was not only the staff at Cancer Treatment Center of America, but my husband, close friends. I had so much support, and I didn't give up. I leaned on my faith. That was all I could do. So now, I finally, as of August of this year, have reached my 5 years for the first time. And August the 30th, I was removed from taking the second hormone blocker that was prescribed to me. So I go back for a follow-up, and prayerfully, I don't have to be put back on